Melissa Herbst-Kralovetz is at the vanguard of women's health, an area that's been significantly understudied in the past. But she's really pushing the boundaries of understanding how the microbiome and other factors in a woman's health affect fertility and her overall well-being. She's made a huge impact on this area.
Dr. Melissa Herbst-Kralovetz has established a cutting-edge research program focused on understanding host-microbe interactions, for example, looking at vaginal bacteria and how it influences gynecologic outcomes. She's also developing biomarker-based tools for early detection of cancer, and all of this is just transforming the way we approach women's health.
In our lab, we work on a whole array of different women's health conditions, right? So there are a lot of unanswered questions in women's health. What we've been focused on is studying the microbiome, but also more recently, better understanding the cervical vaginal microenvironment in terms of how those changes might relate to pathophysiologic mechanisms of disease. Early detection of endometrial cancer is really important because that directly correlates with how well women do once they've been diagnosed. Ovarian cancer was always known as the most deadly gynecologic cancer, but endometrial cancer has actually surpassed ovarian cancer in terms of deadliness. And I think that's something that most people don't realize. Currently, diagnosis requires painful and invasive biopsies, and that also requires healthcare setting. So this can create a real barrier for certain women to seek care. What excites me most about women's health innovation, particularly in our lab, is being able to design a test that could be self-collected to empower women, that they could do that in the privacy of their own home, as easy as a pregnancy test, and get answers, which would then ultimately improve outcomes and save lives.
In Arizona, Latinas, Native American women, and those living in rural communities often face delays in diagnosis and worse outcomes. Non-invasive diagnostics could bring care closer to home, reduce disparities, and ensure that every woman, regardless of where she lives, has the opportunity for early detection and better health outcomes.
If we could break down those barriers, and if we could create non-invasive diagnostics for women, more women would access these tests, and more women would get diagnosed at an earlier stage where we can intervene and they could have better outcomes.